Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. Millions of people suffer from anxiety and stress, but less than a third actually seek treatment. So today we're talking with Dr. Rebecca Denning about how to know if you're suffering and what you can do about it, how you can get some help. Tell us, what are some of the signs that you are feeling that anxiety and stress?
Sure. When we talk about anxiety, stress, worrying, they're emotions that everyone experiences, and they're really important so that we can get things done or we know when there's a sense of urgency. But we talk about it being clinically significant when it starts to get in the way of doing the things that we need to be doing. So when we are so distressed that it's hard to function, or when we notice that we're starting to avoid things that need to be done because of that distress, like avoiding tasks at work or school or things like that. When it starts interfering with sleep and concentration, and people around you tell you you're very irritable. So when those things start to go on, then we think about it being clinically significant and something that we want to address before it gets worse.
Mm-hmm. Should you worry about being labeled or judged? I mean, I feel like anxiety and stress is something we all experience, especially in certain times of the year. It can be really hard, and people are afraid to seek treatment sometimes because they don't want that label.
Sure. Well, I think it helps to know that you're not alone. Like you said, this is something that so many experience. Depending on the age range, 20 to 30% of people do experience clinically significant anxiety. And the good news about that is that we have really effective treatments that we can do for this. And if you're worried about coming in for treatment, I think that one of the nice things about medical offices that have integrated behavioral health professionals into their clinics is that it's the same as going to your doctor. So you're right there talking to someone you're used to talking to about your health information, and there's an extra professional they can link you with to help with a specific problem.
So let's talk about the impact of the whole community. When you're talking about millions and only a few get treatment, they can have a big impact on the entire community.
Absolutely, especially with that avoidance piece that we often see with anxiety. So people start to avoid things that make them anxious. That's our instinct. When we do that, when we tell ourselves, okay, I'll call off work today, or I'll put that off till tomorrow, we instantly feel better. The problem is that over time, that makes the anxiety stronger and really gets in the way. And so it starts to affect others in our community because our own ability to function and to be productive and to be connected in our relationships is impaired.
And when you call off work, it's the whole team that's affected. So that's kind of the ripple effect that you see. What would you say some of the contributing factors are to anxiety and to stress? I mean, we all have to have a little bit to get up and get things done. But what are some of the things that can make it go more towards that this is an issue we need to address?
Right. Some of us are just wired to be a little bit more anxious than others. Like I think we all. Oh yeah. Well, yeah. Absolutely the same. And I think that we all know people who might be wired a little more like us, prone toward anxiety. And there are also people where all kinds of chaos can be going on. It just doesn't seem to affect them in the same way. So some of us are more vulnerable than others. But then the demands that are on us play a big role in that. So anytime that we feel that there are more demands than we have the resources to cope with, that's a big factor, whether it's like financial demands or big changes or losses, or even if we're at a place in our own lives where we feel our ability to cope with things is just impaired for whatever reason.
What are some of the things that you can do sort of to help yourself at home and try to bring anxiety and stress down?
Yeah, well, I think a big part of that is to remember that our brains are wired to be on the lookout for problems. And so one thing that can be really helpful is to intentionally put yourself in contact with things that remind you that even when it's not all going smoothly, things are okay. And so that might be things like remembering times that you've felt similarly and gotten through it successfully, or you've navigated tough things. It might also be making sure that you're present in connections with people that are positive and are part of your coping network. Sometimes it's things like allocating time that you devote yourself to worrying and making sure that during time that is outside of that, you're reminding yourself, oh, I'll worry about that later. You might practice mindfulness. So sometimes when we're caught up in the sense of being overwhelmed and our brains are racing down the road and worrying about all the things to come, it can be helpful to pull ourselves back to just this moment. What's going on right now? What is it that I need to focus on right now? Because usually just this moment is plenty for us to focus on.
Yeah, compartmentalize things just a little bit. If you feel like you do need help, how do you go about making an appointment?
Well, you can call any of our Valley Health offices and they will link you with a behavioral health advocate who will ask you some questions and make sure that we get you set up with a clinician who's likely to be a good fit for you.
Okay. Lots of ways to get help, and anxiety and stress is something that millions are dealing with, so people are definitely not alone when they're seeking help.
Absolutely not.
All
Thank
right.
you.
Thank you so much. Thanks for being here for Valley Health Minutes. We'll see you next Monday.